As the update continues, we're going to take you to Tomah Health. They have a new program going out there. It's the OZ program, and what it is, it's a reusable to-go container that they're currently using in their cafe here at Tomah Health. We're going to talk with Michelle. She's going to explain it all to you, and that's what you're going to see next as the update continues. As the update continues, we're at Tomah Health talking with Michelle. Michelle, talk about a program that's been going on really since July here at Tomah Health, and it's been very successful. Talk about it for me.
Sure. We, in July, brought on a program called the OZ program. It's a program where you use disposable containers, or to-go containers, instead of disposable trash containers for people that take food back to their office or back to the units that they're working on. And we have plastic containers now that we wash and reuse anytime anybody wants to take a meal. So we probably save right now 100 disposable containers from going in the trash each day, so about $500 monthly on this program. And so we're able to use that money for food instead of trash.
Okay, bottom line, take me back to July when you first started doing this. What was the response from the people when they found out you were doing this? What was their responses in general?
Our administrative team was really supportive of beginning the program in the first place, which was great. So leadership on down, we've just had a really great response to it, and people seem to really understand what we're trying to do by saving money on disposables and spending that on good, healthy food for people to eat instead.
In a typical day, how many people will probably take advantage of this if it's a typical day?
On a typical day during the week, we probably do about 100 each day.
And when they're done, we're going to show this in a moment, they put them in a box, so to speak, right?
Yep, that's right. We put them back in a box where they return other dirty dishes, and we wash them and reuse them again the next day.
So what's the advantage for this, say, the old-fashioned way? What did you do before this, and why is this such a big advantage for you?
What we did before was we just spent a lot of money on disposable containers, and we took out a lot of trash. And now we put in a lot more effort into collecting them and washing dishes. It's a lot more work for my staff, but everybody's been really supportive and happy to participate, including my staff, which is incredible.
So the bottom line is you're saving money.
Bottom line is we're saving money, and hopefully, our little chunk of the environment over here.
I would think this would be something a lot of colleges would probably use, but from a hospital standpoint, you've got to be in minority, correct?
I believe so. A lot of big universities, that have students living in dorms and big food service operations use these. They're kind of the early adopters of them. Increasingly bigger campuses, or bigger hospital campuses are using them. I'm not sure of any locally, to be honest. So I think definitely we're an early adopter of something like this in this kind of setting.
All right, we're in the middle of October. This has been going on since July, but let's say somebody comes here today for the first time. They're not familiar with what's going on. Do you still see a lot of that? And they're wondering what's going on or not?
Yeah, I think, our staff really knows what's going on. I think people outside of the hospital that come in might accidentally take them home, and they really need to stay here. So that's maybe been one small issue. But I think a lot of people are just curious about what's going on with them, and they ask questions, and we're happy to answer.
So very unique for Tomah, isn't it?
Yeah, I think so. I'm proud of this little program. I think we're moving in the right direction with it. Hopefully it'll become kind of the normal in a lot of places moving forward.
Okay, in a moment, we're going to just briefly, you're going to have you do a brief walkthrough in a moment, be very brief, just give people an idea what we're talking about. But bottom line, what's your job down here? What's a typical day for you?
Me? Oh.
Yeah.
I'm the director of nutrition at Tomah Health. We serve probably on average 200 to 250 meals a day between patients and staff and visitors. So I just run a very busy little hospital kitchen.
All right, just out of curiosity, I'm 73. Mm-hmm. I can tell you for the record, I do not eat healthy. Am I in this boat by myself? I'm not in the boat by myself. Are there a lot of people of all ages that really don't eat healthy, or am I in the minority?
Oh, I think we can all do a lot of work to improve what we're eating in general, from the best to to the not so great. I'm in that boat some days, right? But no, I think here at least we are really able to serve a lot of really healthy meals to staff, and I'm really happy with the amount of vegetables we run through here.
So in your particular job, what type of people would come to you? What people looking in are going, hey, maybe she's for me, maybe she's not, but what type of people would you deal with on a regular basis?
Well, here we primarily feed very sick people or post-surgical patients.
Okay.
We have a really large infusion center, and we feed people that are getting their cancer treatments through infusion or other kinds of infusions. So I kind of specialize in sick people.
Just out of curiosity, how many people that come and eat here on a regular basis that maybe, I just out of curiosity, is it normal for people that are not staying here, don't have people staying here to come and have lunch here on a regular basis? Is that real common, Michelle?
Yeah, we have it. The public is welcome to come enjoy our cafeteria during the hours that it's open, and we see a lot of people from the public finding out that this is a really nice space and they like the food and hopefully what we're about.
And what are your hours out here if people want to do that?
We serve lunch every day, a hot lunch from 11 a.m. to 1:30 p.m.
Okay. So it's a very unique program, and if you don't mind, let's just briefly kind of show the people how it works if they were to come out here to eat, if you don't mind.
Sure.
All right, let's just go down.
Gonna walk this way?
Yeah, let's head down. I'll just follow you. Yeah, we're gonna follow Michelle, and it's really not that complicated. Let's say right now I was coming in here to get something to eat. All right, Michelle, I'm here to get something to eat. And the format is pretty simple, right?
Yeah, you just ask for their menus posted up here, and then you
There's
ask.
your menu.
Yep.
Yep.
And then you ask for whatever you might want, and then
Okay.
you can either get regular china, or for staff and people that are drop things off, you can put them in a green container.
And it goes in this green container.
Yep.
Okay. It's that simple.
Yeah. Right here.
Okay, so I go over there to eat, come over here, I'm done,
And then you drop off
and the container is right here. It's that simple.
Yeah.
Wow.
And then
Very
my
simple.
staff takes the containers back to the kitchen where we wash them and dry them and reuse them.
So have they given you an idea of how long an average container can last? Did they throw a number out?
I think it's like 1,000 washes.
Well, it's going to be a lot.
We've only had a 2 or 3 that we need to pull out of production. They're really well made. So that hasn't really been an issue.
Hey, I know you didn't really want to do this, but it's a great idea. It's out here at Tomah Health. And again, very unique. I would imagine if we took a poll, very few hospitals nationwide have this, do they?
I don't think so, but I think more and more are seeing the benefit, especially as food prices are increasing and things like that. And you're just trying to, I'm trying to keep our costs for food as low as I can for our staff and for the people here, and this was just one way to do it. And bonus, it was good for the environment.
Oh, as you wrap it up, take me back to when you started back in July, and they told you about this idea. Were you a little skeptical it may not work?
Yes. Yeah, I was worried that people wouldn't bring them back, and we have lost.
Oh yeah, I could see that.
Yeah, and we have lost some, but far and away, people are really responsible and engaged, and they understand what we're trying to do. So, we've had to buy a few more, but it's been just gone over so much better than I could have hoped for.
That's good to know. Hey, thank you for talking with me. Appreciate your time.
Yeah, appreciate you too. Thanks for bringing attention to it.
All right, so let's recap. Here's the lunch menu. And we're at the cafe at Tomah Health. So I come in, whatever I decide to eat, it's put in this green container as part of the OZ program.
Breadstick? Yep.
So you get the green container like this gentleman has, and you leave. It's that simple. So on this portion of the update, we've been out here at Tomah Health talking about a new program. It's the OZ reusable to-go container system that is currently in the hospital's cafe. And we want to thank Michelle for talking with us. We also want to thank her for showing us how it kind of works, what you do, what the system is. It's all very simple. It's been going on since July, and it's been going over very well here at Tomah Health. So It's something new. It's called the OZ reusable container. You use it when you get your food in the cafe here at Tomah Health. Been going on since July, and we thought we'd give you a heads up to let you know that it's going on. We hope you enjoyed it on the update. Continues. We're talking with Alice Ackerman. Alice, before we sit down and talk about what you do, what do you do?
Hi, I'm very fortunate. I am the Elder Benefits Specialist in the Aging and Disability Resource Center of Monroe County. I am a Monroe County employee.
What age people, a lot of the stuff we're going to talk about today is tailored toward what age of people?
I'm a specialist, so I can only work with people who are 60 and over.
Okay.
If there are people listening that are disabled and maybe on Medicare already, we have another specialist, Kirsten Armour, who does help people who are disabled but under 60.
All right, we're sitting down almost a little past the middle of October. The enrollment period is going on right now. We talked about this off the air. If you watch any TV, you're seeing all kinds of stuff promoting enrollment period. Get a hold of us now. Fill me in. What should people looking in be doing right now?
Okay, so every year from October 15th to December 7th, it is the annual enrollment period to check your drug plan for Medicare. And this goes whether you're on an Advantage plan or have a standalone plan with a Medigap insurance. You want to double check that. If you're in an Advantage plan, this is also when you can change what company you use for not only your health care but your drug plan. And the dates are set. It doesn't make any difference if they're a weekend or not. It's October 15th to December 7th. So right now that's what I'm doing for a lot of our neighbors, is checking their drug plans.
Now, I myself have never gone to Step B, taken advantage of this, called any numbers. Should I have been doing that?
It's a good thing to do because they have new plans that come on the market at all times, well, every year. And there may be a plan out there that fits the doctors you want to see if you're on an Advantage plan that will have a lower premium, better co-pays for you, a better fit for what you have, might be a better fit for your your medications.
So people should be a part. They should, with the enrollment period going right now, if you're mid-60s plus, they should probably take advantage of this, is what you're saying.
Everybody who's on Medicare should do it. If your medications haven't changed, if you want to do it maybe once every 2 years or so. But yes, every year or 2 years you should check your medications to make sure the plan you're on is the best value for what you take.
Right now, we're sitting at the Cooper Ross Senior Center in Tomah. You come here on a regular basis to talk to seniors. Mm-hmm. If there was a meeting going on right now, which there isn't, but there will be shortly, what will you be talking to them about?
Okay, well today I'm here actually doing individual drug plans. So I'm working with people that have appointments. I'll be running the Medicare.gov website for them to see what prescriptions they take and just checking to see what plan is going to best meet their needs for the best cost, where they also want to use the pharmacy. Next week, Tuesday, I will be back here at 9 o'clock in the morning, and we'll be teaching people how to actually do what we call the Plan Finder on their own. It's actually a very simple program to use. You just start typing in medications and it pops up with the one you want. I know there's a lot of jokes about how good the government is, but this is a really wonderful plan, and it's very easy to check your own drugs every year.
Now, when you had a get-together at the Cooper Ross Senior Center last week when I came in, timing wasn't good, so we didn't get a chance to sit down like we are right now, but it was very well attended. So there's obviously a lot of people with questions out there, right?
Right. This year, each annual enrollment period is different. This one is unique because Quartz has decided not to cover 37 counties in Wisconsin anymore. So if you live in Vernon, Juneau, or Jackson County right in our area, Quartz is no longer going to be an option for you starting January 1st. So there's a lot of confusion. It doesn't help when Gunderson/Amplify was telling people from their La Crosse hospital that Monroe wasn't covered, but that's a bad rumor. Monroe County and La Crosse County will still be covered by courts. So if you live in either, right now we're pretty much Monroe or La Crosse, you are fine, you do not have to change. The only time you need to change for sure is if you're, like I said, Vernon, Juneau, or Jackson County. In addition, if you go to a provider that's in one of those 3 counties, the people who live in Cashton, a lot of them use Vernon Memorial. That is no longer going to be an option for you starting January 1. So if you're someone who goes to Vernon Memorial or perhaps uses Mile Bluff, you need to be very careful. If you're on courts, there's a good chance that that will not work for you next year.
So if you're living in Monroe County, you don't need to worry is what you're saying. Elsewhere could be an issue.
I never like to use the term worry. And this is why I just stress it's important
Right.
every year to change, because it's more than just courts. Because you've got, if you're on Humana, there's huge issues with that. Humana is not dropping to Monroe County. The problem is that all the healthcare providers in Monroe County are dropping Humana. So they're telling you they still will provide services
Yeah.
for you. I've heard of 2 doctors that are either associated with Tomah Health or Mayo in Tomah are available. However, I have seen the actual letters where they're telling people, well, your acute hospital is now going to be in Boscobel. And I'm not from the area, so I looked it up. That's 71 miles away.
Yeah.
That's not good. So they're leaving. Several of the United Healthcare plans are no longer accepted at Mayo or Gunderson or Tomah Health. So it's real important this year that you do get a hold of someone or go online yourself and check and make sure that where you want to go and the doctors you want to see are going to be in network with any Advantage plan that you're on.
So, not watching a lot of TV, but when I do, I see a lot of Humana commercials.
Yes.
So you're telling me they're misleading us? Is that what you're telling me?
No, I'm very fortunate I have a supervising attorney, and I did ask her about this.
Right.
And it's one of those things, they are meeting the requirements set out by the federal government, because all the Advantage plans are supervised by the federal government. So they are technically they're in compliance. However, I think all of us would agree living in Tomah, going to Boscobel for your
Yeah.
urgent care or your emergency room is not a real good idea. So I would change.
Alice, another program I think you want to talk about was standalone drug plans.
Yes.
Talk about that for me if you don't mind.
Okay, so you have 2 options when you're on Medicare, well actually 3. You do not have to have any additional insurance besides Medicare, but then you've got a lot of exposure to 20% of the bill, which can get really expensive. So if you're on an Advantage plan, that's private Medicare, your Part B premium stays with the federal government, or excuse me, doesn't stay with the government, it's given to the insurance company. So the insurance company you contract with, whether it's Quartz, Security Health, Aetna, United Healthcare, any of those, they are now in charge of your health care, and your option for prescriptions are either using the one through that particular Advantage plan or going on a waiver program that the state of Wisconsin has called Senior Care. The other option is you've got a Medigap, that's where your Part B premium does stay with the federal government. You have the ability to go anywhere in the United States and its territories, and you will have a separate drug plan for that. Those drug plans you also definitely want to look at this year.
So there's a lot of digest, isn't there?
Yep,
Yeah.
it's pretty simple. It seems to be really a lot.
Yeah.
The commercials make it way more confusing than it
Yes.
is. So that's why I say, this time of year, whether you're on an Advantage plan or a separate drug plan, you just check them. I can help with that. Some of the insurance companies in the area also handle that. Like I said, next week I can teach anybody that wants to come down to the senior center at 9 o'clock in the morning. Come on down, I'll show you how easy it is to do it on your own. We also are going to have a special email that you can do, and just email us your drug list, and then I've got some support staff that are fabulous at the ADRC that are helping me run the drug plans as well, and we'll get them back to you that way.
There are programs out there where if your pharmacy accepts it, you can get your meds a lot cheaper. I myself have had no luck with this. Is this a real thing?
Yeah, I mean, it is, if your medication costs are generally less if they're on a standalone drug plan. It's just how it is. For the last couple of years, one company has been offering a zero premium plan, and I don't know if Wisconsin was trialing it or what, but I'm just real excited this year. There are 6 different plans available with a zero premium. So if you match your medications up to where you want to go to the pharmacy. For a long time, the only option in Monroe County was going to Walgreens and Sparta. There are now some zero premium plans that also work here for Walmart, and the plans are covering both Sparta Pharmacy and the medicine shop better than they have in previous years. So we have a lot more choices in pharmacies, and like I said, you can be taking medications, and if they're statins and your basic blood pressure pills, some things like that, a zero premium plan, the pharmacy you want to go to, and zero copays for the year.
Do most people know what type of plan they have?
Most of the people that I work with do. I can't say, say anything beyond that one.
I switched pharmacies a couple years ago because if I did, according to my insurance man, I'd save money, and I do save money.
Okay.
Is that real common for people to change pharmacies to save money?
Yes, that's where you have to check your plan. It's not so much that you want to switch the pharmacy, the plan that you're on may switch the pharmacy. And that's where, if you're not checking, that's where you can run into some issues.
We're also in a world right now, Alice, where a lot of meds aren't cheap. That's probably never going to change, right?
I think our current administration at the federal level is trying to work on that. It's complicated. One thing they have done is there's this new Medicaid purchase program plan, which is a lot of ways of saying it. What it says is, if you are on a brand name drug, pretty much expect to spend $1,500. If you are on 2 or more, you're going to go through the maximum, which is $2,100. This year, what they let you do, and it started last year, you can go and in January, you contact your drug company plan and say you want to split that money out over all 12 months. They will then take, we'll just say, $1,500, and they split that out, and you continue paying the premium to your insurance company, and then you would pay $125 a month to your insurance company as well, not the pharmacy, to the insurance company. And then when you go to the pharmacy and pick up your Eliquis or whatever, then you have no copay at the pharmacy.
I've heard horror stories about elderly people that are on fixed incomes that have gone a month without meds they should be on because they can't afford them. Is that pretty common?
There again, I don't know how common it is. What I can say is there are different plans available. If your income is at or below 150% of federal poverty, and if you meet certain asset requirements, then the state or federal government will help subsidize your drug plan. There's this fabulous program called Senior Care, and it's a waiver program from the federal government to the state of Wisconsin. It is $30 for the entire year. They do not look at any assets, they only look at your income. So that's another one, because depending on your income, you may not have a spend down at all. You might have a spend down of $500 or $850, and then a brand name drug is $15, a generic drug is $5. Many of the drugs are available for a 3-month time at that $5 cost.
So for somebody like myself that's on a lot of different meds, looking to save money, this is the direction you would go. If I'm looking 7 or more meds, which I have, looking to try to save a little money, what route should people go if they're in that same boat?
Okay, I don't think, it doesn't take 7 drugs. If you take 3 drugs,
all right,
and if you're paying any kind of a drug plan premium, I would highly recommend before December 7th checking your drug plan, because there's a good way, even if it's $5, that's still $60 for the year. There's a good chance you can eliminate your drug premium altogether, and certainly if you've got 5 or 7 meds, go and check. There's different plans that will either, could hopefully lower your cost for you.
The short time we talked about a lot of things, so it was hard for me to register everything. So for the people looking in, obviously they probably didn't register everything, but is there a place they can go to get more information? Can they sit down and talk with you? Because if there's anybody, I guess I'm looking at my viewers right now that maybe still have questions that they don't have answers to. Can you
Sure.
help them with that?
Yes, we're on Facebook, we have a website that you can go to Monroe County, their main one, and pull up the ADRC. We've got some information on that. We have all of our newsletter articles that you can go. I have information, I think, in both the September, October. Our November one is just going to be coming out. I've got more information on the annual enrollment period in that as well.
And I believe today at the Cooper S Senior Center, where we are right now here in Tomah, I believe you have appointments with different people. So people, I'm guessing, Alice, can come down here to the Senior Center and set up an appointment with you and talk about what's on their mind or not?
Generally not at the Senior Center. I do those mostly at my office.
Okay.
But we can arrange that.
Sure.
Right now, I can tell you, I am booking appointments to have drug plans checked is on the week of Thanksgiving already. So
Wow.
I am getting very booked as that. That's why I'm really hoping people will be able to take advantage of the ability to either mail in, if that's easier for you, your drug plan, or send us an email with your drug plan and some information, and we can just take a look at it, send you information back, and go from there.
So how do they make that happen? How do they get this information to you?
Okay, the email address is simple. It's drugplan@co.monroe.wi.us. That's the county's email extension. We'll have that posted on our website and on Facebook for you. And then we just need your list of medications, your Medicare number, and then your current plan, and most importantly, what pharmacy do you like to use? Then we'll send back information on 3 different options, and the lowest cost option will print out all the details. Then you let us know if you want to enroll in that yourself. They'll have the information on how to do that, or if you want myself to help you enroll, then I would just call back or schedule like a 10-minute phone call and enroll you in the plan.
So if people want to talk to you personally, how do they do that?
Call our main number, 608-269-8690, and Samantha will be able to schedule an appointment for that. But like I said, I'm going to have very limited availability left.
So as you wrap it up with Alice, we're sitting down late October 2025. The odds are a year from now, we could be having a totally different conversation, couldn't we?
It'll be probably different challenges, but the same thing, just October 15th to December 7th, check your drug plans.
I would imagine you have a very interesting job because there have to be a lot of elderly people that need the meds, or they're very concerned how they're going to pay for it. So I would imagine every day for you is different, isn't it?
Yes, I feel very, very fortunate, very blessed, because neighbors in the county and across the state and country give me a little bit of their money so I can turn around and help other neighbors out. And I feel very, very fortunate to have the position.
And you've been doing this for how long, Alice?
8.5 years now.
8.5 years.
Yes.
Okay, hey, thank you for sitting down with me. I think what I'd like to do, not a little down the road, maybe a couple, 3 months down the road, to have you come back on a regular basis and maybe
Okay.
totally different topic if you don't mind. But like I said, a lot of my viewers are 65 plus, and that's kind of who you're tailored for.
Yeah.
Hopefully you've answered a lot of their questions, so I appreciate you sitting down with me on very short notice. Thank you for doing this.
Thank you for having me.
All right, the update continues. Talking with Mike Hanson, District Administrator. Mike, you want to talk about some of the items on your agenda. This past Monday, October 20th, the school board meeting. It was also your annual meeting. How did the annual meeting go?
Annual meeting went great. That's an annual meeting of electors that arrive, where our agenda talks about setting, we do school lunch and setting the levy for the year, board salaries, things such as that. So that annual meeting went great. That was started at 6 o'clock, and so right after the annual meeting, we went right into our regular Board of Education meeting soon after that. So it was an active Monday for us.
All right, so let's talk about items on the agenda
You got
Monday
it.
night. What jumps out at you?
Sounds good. Yeah, the first things are always, talking about the great things that our kids are doing. And we are really excited. The board approved several out-of-state and overnight trips for our THS band program. Just fantastic things that they're doing, honors band. And so you've got kids going along with their band instructors to Eau Claire, Decorah, Iowa, and a performance in Milwaukee. So those are really wonderful opportunities for our honor band students. I want to thank our high school faculty and administration, band faculty and administration for getting the kids everything they need to get forward, move forward with that. And then for our students, thanks to their amazing work, they get to really try and take part in some wonderful opportunities that are made available to them in their musical journey. So that's really exciting for them to try and develop and go through that. So exciting deal there for them. Every month we have wonderful gifts and donations to the board, to many of our clubs and activities. And this month we had a $250 donation from Walmart to the Elementary Student Assistance Fund, from Cranfest, a donation to the Tomah High School Band for the parade for $382, and a Spirit Pump donation from Simran Corporation to Tomah High School for $452.90, and a donation from Habelman to the Tomah High School FFA program in the amount of $1,250, and this month $2,334 of donations. Just fantastic. You can just see the breadth of the clubs and activities and that those donations impact. So each and every month we're so grateful for our community in many ways, and for our donations as well. Other things that we're starting to do, we recently had a joint city-school committee meeting, and so we want to thank our city committee for working with us on that, setting that up. We meet over at the city chambers. We've got our first meeting under our belt. We talked about crossing guards, and so as we continue to move through the school year, that committee will set its meetings and have its topics to discuss. So just really nice connections there and conversations. And then certainly, as we talk school safety and many other topics, if there's ways that when we have those collaborative opportunities, we do that. And so we did spend a lot of time just talking about the powerful relationship we have with Tomah PD. Chief Pedersen was there, and the officers that not only respond to things that happen in our districts, but absolutely they're educating our students too. We're excited to have DARE start in our fifth grade in town, and then want to thank Monroe County Sheriff's Office as well for starting our DARE program in our outlying schools for our fifth graders. So along with fire, ambulance, highway patrol, everyone that takes an active role in ensuring our community is safe, they also ensure that our school community is safe as well. So just really appreciate our work there, and look forward to that ongoing work with the city through this capacity in the joint city committee planning stage. As our board takes a look at their own professional development and building their skill set, their advocacy, we're getting ready for the January Wisconsin Associated School Boards meeting, and so we have that on as agenda item to talk about things that are going to be presented there, and just also remind our board members that it's a great opportunity to grow as a board member. Not uncommon at all to have 4 to 5 of our members go, and so very exciting for them to do that. We also are dedicated to our employees, all employees in the district. They just do amazing things each and every day. I get to see that a lot when I get out to the buildings, and just the great work they do for our students, for our community, and for everyone to elevate the experiences of our students. So we're going to have 3 meetings this year to talk about those opportunities that they see where enhancements to wages, salaries, benefit structures can go. Normally we've had 1, but a board priority is increasing and improving communication opportunities, and this is certainly one area that we can do that. I want to thank Katie Rice and Teresa Devine, who sit on the Meet and Confer Committee, as they will chair those meetings and gather that information, and can bring things to our full board for consideration in the future. So we're looking forward to those. Another area that we're taking a look at is setting a waiver out to Wisconsin Department of Public Instruction to see about starting school prior to September 1. There is a way you can do that. Public schools have to go September 1 or after, but our private school partners can go but before that. So with transportation running already, it'd be nice if our students would be able to be on the buses as well. So we made an application to Wisconsin DPI to see if we could start August 24th with our transportation assets already going. So that'll be up to Wisconsin DPI. If that waiver is accepted, we've got a calendar, we'll build around that. And then if it is not approved, we'll have our September 1 start calendar. So it's something you can do and for 1 year, and we'll see how that goes. We'll let everyone know how that turned out in the near future. We also had a lot of work at our annual meeting was centered around the budget. Michelle Clark did an amazing job presenting a $50 million plus budget to everyone, and that is a lot of work, a lot of planning year over year, and just tremendous opportunity at the annual meeting for those present. We had about 25 people there to learn more about the budget, ask questions, went very well. So the Board of Education from the annual meeting and the previous budget discussion meetings we've had over the last 2 to 3 months, the new mill rate for the district is $539.72 per $100,000 evaluation. So that's down from last year's $551 per 100,000. You can see all of that information and a lot more right on our website as you go to the annual meeting from October 20th. In the annual meeting, and then also over the data that's associated with that on the October 20th, 7 p.m. regular meeting. And right here in our district office, we have a nice packet of information that gets very, very detailed, down to the operational level for things. So it's very well done, and we do appreciate our community's support of everything that we do for education. We had a few policies that are up for review. And the board approved several in second reading, and then we had about 4 of them in its first reading. So not a bad night for policy as well. So very active board meeting.
And there were some items at the beginning of the meeting dealing with the band, right? The band's going on the trip.
Yeah, you bet, absolutely. Our
there was
band,
a couple of band items, right?
Yeah, you bet, absolutely. Our honor band is going, the high school honor band are going to 3 different events, and the board approved those as they're overnight and out of state. So the kids do fantastic work with that. So we're excited for them to have those new experiences in music. And I want to thank Alex Knepker and Jed Schraufnagel and all of our band folks that are in charge of that and provide their gifts and talents to have our kids extend their growth as musicians through these opportunities.
Like almost 2 months into the new school year, how's it going?
Going great. We're doing a lot of great things. All of our activities, certainly are moving along. Our clubs and school in general. So it's really something to say. We're almost 8 weeks deep into this, so it goes fast. So we're looking forward to continued work as we get near that traditional time of winter break, and soon, Greg, we'll be talking even more about the 26-27 school year as we start preparing for that at the board level.
Yeah, as we sit down, we do want to get a plug in this weekend, Friday, Saturday, Sunday, the elementary musical going on. It's always very well attended, and these kids do a great job. So if you get a chance, check out the elementary musical this weekend.
Thanks for
just the
bringing that
start
up.
of many
Absolutely.
school events coming up.
Yeah, you bet. A lot of going on. We appreciate everybody supporting our kids, being a part of that, leading those activities, showing up. That makes Tomah Area School District a great place to learn and grow.
Just one final thought on the Joint City School Committee. Do they meet on a regular basis, or will they meet when they need to meet? What's the format
A little
for that?
mix of both. That was one of the agenda items. So they'll determine when they'd like to meet, the type of things they'd like to discuss. So it'll just be a really great opportunity, and folks can view those. They're held at city chambers, so they're noticed through the city process, and then we notice it on our board website. But you can be there at City Chamber, or you can watch. So they're live right there.
So your personal take is this is good. This is a good thing, right?
Absolutely,
Okay.
yeah, you bet. We've got partnerships all over the place, so it's going to be very well done.
Mike, as usual, appreciate you doing this on very short notice. Thank you for your time, and we'll talk to you next month. Appreciate
You
it.
got it. Thanks.